Well, I guess the easiest way to answer that is it's still to be determined. The study that we described here really is a proof of concept study, and we're hopeful that this significant shot on goal is going to translate to a next generation tracer that will have a pretty significant impact on the diagnosis of Parkinson's disease. But I think the broader question you're asking here is really around what's the potential impact of any synuclein PET tracer on the field of Parkinson's? And we think that this could be pretty substantial. And we liken it to essentially what we've seen in the Alzheimer's disease field, where the implementation of PET tracers to beta amyloid or tau had a very significant impact on your ability to understand the underlying disease progression in Alzheimer's disease, to better select therapeutic targets, or to select better therapeutic targets, to better understand when the disease actually starts and how biomarkers relate together. But ultimately, what we really hope these PET tracers allow us to do is to design more effective therapeutic clinical trials that test therapeutic agents. As it stands now, that is a challenge in the field, and we're really hopeful that these PET tracers could have a meaningful impact on our ability to execute in the clinic. This Michael J. Fox Foundation is a fantastic organization. We've worked with them for many, many years on this project, but also on a broader context of Parkinson's disease. Basic preclinical research. They're a great group of people. I've known them for a long time. With this project specifically, we have been in close collaboration with them for probably, I want to say 10 years now. Maybe not that long, maybe 7 or 8 years, in which we initially had just described our program efforts with them and got some feedback on them. They got us access to some pretty critical tissue samples that allowed us to better characterize our emerging PET ligands. And then ultimately, we worked with them. We applied for and were awarded a winner of the Ken Griffin α-synuclein imaging competition, which essentially provided funding for our preclinical program efforts. So it's kind of hard to imagine, it's kind of hard to disentangle this, but it's I would say it's been a pretty close collaboration with the Fox Foundation throughout the history of this program, eventually leading to this clinical trial in which they were also an important part of that. As it stands now, executing an appropriately powered disease modification trial in Parkinson's disease is considered to be a pretty significant challenge, given the number of patients that are required to recruit for each arm of that study. We see biomarkers as having the potential to reduce the number of patients needed to recruit, and also to provide a little bit better diagnostic accuracy of the progression of the disease and whether a therapeutic is actually intervening in that process. When we rely on the clinical rating scales like the UPDRS now, the degree of change that you observe per year is relatively small. And so to see an impact on that requires a pretty significant therapeutic intervention. And we're hopeful that a biomarker can give us a better insight with a larger window to see the effect of a therapeutic in intervening in the disease process. Yeah, that's where we're really hopeful, is that one of these PET tracers will give clinicians the ability to track the disease progression in patients, in living patients. As of now, our understanding of disease progression comes only from postmortem tissue studies and our hypotheses about what we think is happening in the disease. These PET tracers give us the ability to potentially test the Brack hypothesis to see whether or not the disease actually progresses the way that we think it does, and the rate at which it progresses, and the rate at which it progresses and across brain regions, and what time scale that happens on. And ultimately, it gives us the ability to pick therapeutic targets that may have a more meaningful impact for a specific patient and the stage of disease that that patient happens to be at. So we might have therapeutics that are better targeted for very early stage disease and the progression that's occurring at time, and we might have therapeutics that down the road are targeted for more advanced disease, and we can better refine where a patient is in the disease continuum or spectrum, and to better target therapeutics for those patients.